Hi, I'm Dr. FeelRight, giving you common sense solutions to everyday problems. Today I will tackle a topic that has been at the center of controversy between the worlds of traditional and alternative treatments for health issues. It is entitled Herbs That Work and Herbs That Don't. In the medical community, many doctors discourage any treatment that is not a prescription, and they downplay the efficacy of herbal supplements. The reality is that many traditional medicines were created from herbs, and herbs are sometimes potent and at times more potent than the prescribed medication. Some are gentle and act over time, where some are strong and immediate. Herbs are not a subject to be brushed aside as ineffective, nor are they so benign as to be taken lightly. They have been used for thousands of years, and even the great Hippocrates used herbs as medicine. But not all herbs are effective, and some have side effects. Over the years, I have studied thousands of reports and spent thousands of hours determining which herbs have value as preventative measures. And although I have not taken every herb in existence, I have researched and taken a large number of the most prevalent ones. I have formed an opinion through research topics and trials, and using the herbs for certain ailments, as well as recommending certain herbs to others, of which herbs have a value in prevention and as for maintaining well-being. Now, this is the first of a series in which I will share these observations that I've made over the years. And this is not meant to treat a specific ailment or disease, and if you decide to try these herbs, you should consult your health practitioner. Also, do your own research. Your health is personal, and it should be active, and you should be at the center of creating and maintaining your health. Now, with that being said, let's discuss these herbal supplements. The first one we'll talk about is aloe vera. Aloe vera is great for the skin. It's a great emollient. It heals wounds and burns, and it also treats constipation. But there is a caveat and a caution. This is not an herb for pregnant women, but in most cases you can see that aloe vera is used in different over-the-counter concoctions as well as some drinks. Aloe vera is a very, very valuable herb to have in your arsenal. Arnica. Arnica is used in gels and lotions for relieving pain in joints and muscles. It is a very effective treatment for sprains and the pain of arthritis and rheumatism. And there are no known side effects. And this is an herb that you should be taking externally, not internally. Astralis. This herb is an adaptogen, meaning it takes care of what ails you, be it stress or tension or whatever. It adapts to you, basically. Astralis is called Han Kui by Chinese herbal practitioners, and it is said to tonify the heart and cardiovascular system. It's included in many Chinese herbal treatments. Ashwagandha. Ashwagandha is another adaptogen which is common in the Indian Ayurveda system of herbal medicines. It is a stress and anxiety reliever, and it is said to be a mild muscle relaxant. Ashwagandha is a good supplement to counteract the daily stressors of life. Bilberry. Bilberry is a fantastic supplement that promotes vision and treats nyctopia, which is night blindness. Back in World War II, pilots were given bilberry jam before night missions. It's just that effective. Bromelain. Bromelain is found in pineapple, and it is good for bruises, injured tendons, and it dissolves protein which is bound in ligaments. It's good for the cardiovascular system by dissolving rogue proteins that may be circulating in the bloodstream. And if you suffer from a painful tendon or ligament problem, and the doctor is leaning towards a surgical procedure, you might want to try eating fresh pineapple every morning on an empty stomach for 10 to 14 days, and just see if that makes a difference. This worked for a woman who was in a similar situation, and I recommended this for her, and she was walking freely after 2 weeks, avoiding surgery altogether. Now, there are no guarantees that this will happen for you or work for you that way, but eating a few pineapples versus tens of thousands of dollars in surgery and rehab makes bromelain and eating pineapple worth a try. Butcher's Broom. If you're suffering from a lack of circulation in your lower extremities, Butcher's Broom may help. It helps to dilate the small veins and arteries, leading to increased blood flow in the lower extremities, meaning your legs and your feet. Butcher's Broom has also been shown to be effective if you suffer from hemorrhoids. Chamomile. Chamomile is a mild sedative herb that can be taken in capsule form or drank as a tea. It is relaxing, and many use chamomile tea as a sleep inducer. Virtually every tea concoction that you can buy that advertises for sleep or tension relief has chamomile as its #1 ingredient. Cayenne. Cayenne pepper contains capsicum, the substance that gives it the heat. Capsicum is a very active ingredient, and cayenne is said to use capsicum or that heat to lower blood pressure, although the evidence for this is mostly anecdotal. It's said to dissolve blood clots and to keep blood flowing. Also, the evidence for this is mixed. However, it does cause a thermogenic effect due to the heat of capsicum, and the pain from capsicum triggers endorphins for a euphoric effect. Now, be advised that eating peppers that are very hot, such as the vaunted ghost peppers, could damage your stomach and intestinal tract, as well as lead to confusion and an accelerated heart rate and sweating. Catnip. Not only does catnip drive your kitty crazy and wild, but it does the opposite for you. It calms you down and relaxes you. Catnip is a mild sedative, and many drink catnip tea to soothe jangled nerves after a hard day's work. Cranberry. It turns out that drinking cranberry juice is an old wives' tale, but it's true. It actually does prevent and treat urinary tract infections. The cranberry juice, or the active ingredients in cranberry, makes it impossible for infectious agents to stick to the urinary tract and are washed away. Now, you have to be cautious of this when you're dealing with cranberry. A lot of times you will see the cranberry juice cocktail that's in grocery stores, which is sugar sweetened and is more of a drink. And that will be useless in the case of curing a urinary tract infection with cranberry. You can only use cranberry supplements or drink pure, unsweetened juice. There's no exceptions to that situation or that rule. Dandelion. Dandelion is a natural diuretic, which is useful for flushing excess fluid from the system. It's a potent antioxidant, and it helps to lower blood pressure. And that's probably because of the diuretic action of removing the excess fluid from your body. It's also great for people who suffer from metabolic syndrome and its resulting inflammation. If you suffer from liver ailments, dandelion should be in your arsenal. Studies have shown that it has a protective effect on liver tissue in animal studies. Also in vitro, the tests have shown that dandelion leaf extract can inhibit the growth of cancer cells in liver, colon, and pancreatic tissue. Dunquad. This is known as female ginseng. It is great for women that are suffering from cramps or PMS, and it also can be taken by men for anxiety or stress relief. Echinacea. Echinacea has been said to be able to prevent colds and flu, but there's little evidence that it either promotes or prevents anything or shortens a cold. The hard evidence is practically non-existent that it does anything for a cold, but it has a lot of anecdotal evidence from people that swear by it. Personally, I saw no effect from echinacea in any way, shape, or form. It is said to strengthen the immune system, yet I have observed little more than what seems like a placebo effect with people that take echinacea. But that may work for you. It didn't work for me. Eyebright. Eyebright is an excellent herbal supplement, and in combination with bilberry, it can show significant improvement in eye health and visual acuity, as well as night vision. And there you have it, the opening volume of A to Z of herbal supplements that I have observed that have a significant effect on well-being, as well as some that have little benefit as opposed to the claims made about them. Try them for yourself and see if they make a difference in you. I'm Dr. FeelRight. Thanks for watching, and as usual, have a great day.